Hi guys, so today's video is going to be on the essential question, what kind of medical help or support is necessary when doing TMS work, and how do you decide? How do you decide when you need more support? So the first thing I'll say, and I say it often, is when you feel ill or pain or something that makes you know that something's not right with your body, the first thing you do is get checked out by a medical professional. I'm quoted often as saying, I don't want to have someone try to journal away a tumor. It is absolutely essential that you make sure your blood work is good, that you get the right tests, that you talk to your doctor and figure out if there is something that needs a legitimate structural medical intervention, meaning if you have infection, you need an antibiotic. If you have a tumor or growth in any way, you may need it removed. I'm not a doctor. I don't know. But there are certainly things that I never ever want to go unnoticed. Having said that, there are so many things that are seen as structural abnormalities, but a doctor or a professional has a treatment but no cure, meaning, well, you may have to live with this forever, but, we could try this injection, or, your bulging disc really could use the surgery because it's leaning on your nerve, but there's no guarantee of pain cessation. One thing I've learned in my many years of doing this is that bulging discs do not cause pain. Abnormalities in the spine, like spondylolisthesis, like what I have, do not cause pain. They are real. They are, as Dr. Sarna would say, normal abnormalities. They're part of being alive, but they don't cause the pain that you're feeling. And I could never say this confidently if I hadn't lived it in my own body for over 20 years and helped thousands of people. So I'm not saying this lightly. Other things that I have found are chronic, where doctors say, we can offer you some guidance, but no cure. A lot of stuff around pelvic pain, around changing your diet, around certain pelvic floor PT. And I'm going to get to how you can do PT and massage and acupuncture and stuff like that safely in conjunction with the TMS treatment. But just to say, there are a lot of things like migraines, fibromyalgia, stomach issues, pelvic issues, where people are told, change your diet or do certain interventions, and they just don't work. And so sometimes what you need to do is you need to do what you need to do. So when is medical intervention necessary? Until you get it deeply that it's not. Meaning, I know some people who have to have a back surgery and have it not be effective in order to move over to this work. And I know a lot of people who don't need to go through that. You need to decide for yourself. I am not here to shame or to argue against anyone's intuition. That's the most important thing. I'm here to tell you from my personal experience, I've never seen someone have a back surgery and have that be the reason that their pain is gone, because maybe their pain leaves for a period of time after the back surgery, which to me means their nervous system regulated because they stopped being panicked about their symptoms. And then sometimes that back pain comes back in the same place. Sometimes it comes back in a different place in the back. And sometimes it doesn't come back in the back and they notice they start getting migraines. This is very common in TMS recovery. It's called the symptom imperative. So I guess really I can boil it down to a couple things. The first is seek medical attention if you feel that something is new, different, scary, or you feel your intuition that you need it. The second is things like acupuncture, alternative therapies, things that aren't hurting you, they just might not be fixing the issue. Here's what I will say. Therapeutic massage, stuff like that. If you can view whatever intervention you take through the lens of love and not fear, and what I mean by that is, if you can go because it feels great to have the support, if you can go because it feels like you're doing something good for yourself, that you enjoy the appointment. Like I have an acupuncturist, I haven't seen one in a while because it was where I used to live, but I used to love going to her. She was awesome. I loved the way she looked at the body and health and life. We had interesting conversations. She gave me acupuncture. Do I think the actual treatment made a huge difference for me, not me personally. But it doesn't matter because I have friends who have loved their acupuncture experience. But if you go in being like white knuckle, this better fix me, this better fix me, your nervous system is up to here. You're in fight or flight. You're so urgent. You're sending messages of danger because of your fear and your attitude. It's only going to make it worse. Same for therapeutic massages. Same for any treatment that is something that is supposed to soothe you, help you, further your recovery. It will only further your recovery if you can wear it loosely and if you can see it through the lens of love. So if you can see it, once you've gotten checked out and you know nothing is dire, if you can see something through the lens of love, like physical therapy, and you can go and connect with your therapist and strengthen your core, great. But do not go with the panic that this must fix me, because the only message we need to send to the nervous system is one of, ding, 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 safety. I send you love.